You can mute yourself when I'm talking, just in case we both don't break. And then don't forget to unmute when I hand it over. Hello, everyone. Raj, am I audible? Yes. So I think we'll just wait a couple of minutes and then we'll begin. Thank you for joining. Okay. So good evening, everyone, and good morning or good afternoon if you're joining from elsewhere. Thank you for the overwhelming registration. I think the audience is just trickling in, but we will begin the session. So, hi, I'm Lulu. I'm from Father Miller Medical College, one of the executive board members of the Society for Healthcare Simulation. And on behalf of the society, I welcome you all to the webinar series, which the SHS is conducting. And today's webinar is on virtual bootcamp, a how-to guide to harnessing the power of internet for simulation teaching. And I'm glad to introduce the speaker for the day. a very good friend of mine, Dr. Rajkumar, and he is a consultant emergency physician and clinical lead of simulation at GSL Medical College, Rajamundry. He is also a regional faculty for the American Heart Association, and he's the course director for National Disaster Life Support Foundation, USA. He's presently pursuing his Mahe Fema Fellowship at Manipal Institute, and he is also a dynamic member of our society. And over to you, Raj.
Thank you so much for the introduction, ma'am. And I'm really glad the SHS let me talk about this very interesting topic. I'm a bit of a tech enthusiast, and I really think technology can transform learning in the future as well. It's come to a point where we have been forced to use technology for teaching, right? I'm sure most of you are not happy about it. I'm sure some of you are finding it a little difficult to accept technology usage in teaching right now. But evidence has shown over years that even before the pandemic started, there was trickling in evidence that online learning, blended learning, e-learning is the way to go forward. And we'll talk about that evidence as well. But this workshop is by no means an exhaustive list of technology, right? Because I'm a tech enthusiast and because I've been going through pouring over resources online, I found a lot of tools that we could be using, but we are not using. So that's the focus of this particular workshop, this particular webinar rather. We'll talk about tools which are immediately available for us to access and teach our students better, right? I'm firmly of the belief that with this millennial generation and Gen X generation of medical students, we have to push them to use smartphones in the class rather than restricting them from using smartphones. Because if you try the latter, it's going to fail. It's going to fail very badly. So rather than restricting them from using technology, which they will eventually behind your backs, let them do it in front of you. Let you push them to use technology in your class, so you can do it under your supervision, right? You can watch them use technology for their own betterment. That's the idea of this particular webinar. And how can you go about doing that? So let's quickly jump into the topic. Right. So virtual boot camps, and I'm Dr. Rajkumar. I'll be your presenter for today. So virtual boot camp. The term virtual itself is quite controversial, right? If you look at virtual, people derive different meanings from the word virtual. For a more advanced tech enthusiast or for a newbie or a Gen X kid in the medical college, virtual might mean virtual reality. He might immediately imagine a huge device over his eyes, ears closed off, and he's in a virtual space where he's playing a game. That could what virtual reality could mean for a new generation kid, right? A new generation medical student. So the term virtual usage for teaching is a little controversial. Obviously, in this current webinar is not about that. This current webinar is about something called distance learning or e-learning, right? So this entire terminology of nomenclature of whatever we are doing right now is controversial. It's not established in medical education yet. It's not established in science yet. So there is a lot of debate about it. I'll talk about that eventually. So we need to understand where we stand right now as per this particular modality of teaching, this particular modality of delivering a lecture through a computer device, through the internet, right? Uh, we are at a place where students are coming back to college. We are at a situation where we are moving away from technology again. We are going back to the traditional classroom method. But is that a good thing? Should we probably implement what lessons we learned from the pandemic and use it in a blended way so that we can use both classroom teaching as well as internet teaching, e-learning, right? Tools. We'll talk about an exhaustive search, a rather incomplete exhaustive search, if you will, of all the resources that are available online, which you can use to not only teach better, but also assess better. Because we always, people who do a lot of assessment in their learning, we always talk about assessment is for learning, AIFL, assessment is for learning. So how to use technology to teach, learn, and to assess, right? And we'll talk about the assessment part of it. So a year ago, when the pandemic was at its peak, and we started realizing, students are not coming back to the simulation center for a long time. Students are not coming back to skill lab for a long time now. There was this healthcare distance simulation collaboration, a summit of sorts, conducted by the International Pediatric Simulation Society. I was fortunate to be part of that society, and there was a huge debate from simulation teachers all over the world about what you should call this modality of teaching. This modality of teaching isn't me teaching you through this computer screen. What should we call it? Should we call it e-learning? Should we call it virtual learning? Should we call it distance education? Should we call it telesimulation? What is the right term, right? And as you might expect, with so many people giving in their thoughts, we could not come to a conclusion as such. There was a year-long hiatus about what we should call this particular technology, what we should call this learning, right? But we understand, there is supposed to be a set of rules. There's supposed to be a set of guidelines, a set of principles guiding this kind of learning, which is not there right now because we just got into it. We're just doing this right now. Most of us don't even know what we're doing. We're trying our best, right? I'm pretty sure you never imagined that you'd be sitting in front of a computer screen and teaching your students about anatomy and physiology and complex algorithms and things like that. But that's where we are. That's where the pandemic has pushed us to, right? So this distance summit was ended in a hiatus. We didn't decide what to call it yet. But the general observation was distance simulation and telesimulation is likely a good unit of measurement of what we're doing right now, right? Rather than using the terms like virtual learning or e-learning. So what is the evidence? Where do we stand right now? What do we know so far about online learning? How effective is it? The obvious reflex is to go back and think that this online learning is not effective because we know we're teaching every day. There's no two ways around it. When you start a class, the first 5 minutes the students are there. The next 40 minutes the students are not there. They're just not there in the class. Either the webcams are off, they completely disappeared. You ping them, you ask them to unmute or open their webcams. It's not going to happen. It just doesn't happen. But evidence actually proves to the contrary. 72% of American organizations says they say that e-learning gives them an extra edge, gives them a competitive edge. In 2017, this is as of 2017, 40% of Fortune 500 companies used e-learning to help teach their employees, right? This was in 2018. This paper was published in 2018. It projected that there would be a $325 billion market value for online learning. And this was not taking the pandemic into consideration, right? We had no idea back then that there would be a pandemic and it would shift completely to online learning. Now you can imagine that the capital, the amount of investment that goes into this, considering where we are right now, it could probably be double or triple. So when you allow an employee, rather a student, to learn at their own pace, the retention rate is 25 to 50% higher. That's what studies show. Transfer of knowledge is greater. The performance improves by 15-20%, and the cost savings are, which I don't have to tell you, the cost savings are 45% or more. And this is again from the American Society of Training and Development study. So the average retention rate for an instructor-led class is 58%. You're in a classroom, you're teaching a classroom, despite your best efforts, despite the greatest pedagogy you employ, the average retention rate for an instructor-led classroom is around 58%. But the e-learning experience can increase this by 25 to 67%. That is a huge markup from what you would expect in a instructor learning, right? But all this comes at a cost, and all this also takes the right amount of tools, which is what we have to learn about. What tools will help you catch this retention rate, this increased retention rate? So who are these millennials? How do you define these millennials? How do you become a good millennial teacher? How do you make a name for yourself amongst these millennials? 39% of millennials want to see more virtual education, right? They want to use technology. They want your teachers to employ technology in their learning. And by 2025, that's where most of these kids will graduate. 75% of the gradual workforce will be millennials. So this on-demand learning is what we call it, right? They want it. So it's called on-demand. This on-demand market is growing, right? The number of consumers are growing. And with the pandemic, it's been a huge uptick. But because of the third wave not being as hard as it might expect, as we expected it to be, students are coming back to college right now. So there's a drop again in the graph. But we should not take that for granted. And we should not let it be, because we should learn from that. We should use that opportunity because now we know technology. Now everybody knows what is Zoom, what is Microsoft Teams, what is breakout rooms, what are Kahoots, what are Jamboards, what is formative assessment in the classroom. Everybody knows what it is. So we should use this opportunity. This is the right time to push students to use technology in the classroom rather than push them away from and make them refrain from using technology, right? So we should employ different means as possible to engage the student in the classroom, because the millennial kid, the millennial student, is a tech savvy student, and we need to come down to his level, or there's no way there's a matchup between us. So the advantages of e-learning is that there are several methods of e-learning, right? There is delivery of lectures where you can do a flipped classroom. In a flipped classroom, what happens is, I'm sure most of you are aware of it, but in a flipped classroom, the student is at home, right? He undergoes a certain amount of training at home by watching pre-recorded lectures or webinars, what we're doing right now, and then comes back to the classroom, where there are interactive sessions, where there are simple projects, where there are simple ideas, breakout rooms in the groups and individuals, and they get together and exchange ideas. But most of the learning is happening at home. This is what is a flipped classroom, because a classroom is supposed to be an interactive environment. This direction, me teaching you, does not work in a classroom, right? Because different students can retain it differently. I might not be able to focus on all the students at the same time. Some students may be paying attention, some students may not be paying attention, but they're all looking at you. So you might think they're paying attention, but you don't really know what's happening. But in a flipped classroom, when all the learning part is done at home itself, they can come back to you in the classroom and you can engage them in more specific ways and don't waste time on lectures, right? That's what the American Heart Association is doing as well, right? If you look at ACLS and PALS right now, the American Heart Association has introduced something called pre-course work, where most of the videos are available online, right? The student can log in, can finish the pre-course work, download a certificate, come to the classroom saying that, guess what, I finished the pre-course work, and you can give them directly hands-on sessions and team dynamic practice. That is great. We're saving a lot of time. A normal ACLS class goes on for 2 entire days. But with this flipped classroom model, with this blended learning model, you are finishing an ACLS course in 1.5 days, which is unheard of. You can focus completely on skills and completely on this team dynamic. So yeah, blended learning works. It saves you time and it saves you cost. Right. So before I jump into blended learning, there are no conflicts of interest here. Nobody's sponsoring me to do this video. So whatever products I show here are freely available or maybe available at a subscription cost, but anybody can access it, right? There's no sponsorship here. Nobody's pushing me to push the products on you. Because I'm an emergency physician and because clinical reasoning is very, very difficult through online teaching is what people believe. I'll show you some very brilliantly available, brilliantly usable clinical assessment tools which can be used for online teaching. The first one I'll talk about is completely free, right? No strings attached, completely free, available for anybody to use. This is something called the virtual resource room. This was developed by a pediatrician in the US, and I will quickly stop my sharing and share my browser so that you can understand better. Just one moment. So yeah, this virtual resource room is basically a very innovative and yeah, let me just share my screen. It's basically a very innovative idea which has come up during the pandemic, which came out as a product of the pandemic, right? Because of the intense stress of the pandemic and people not, stress builds ideas and stress gives a birth to many ideas. So I'll just share my screen, just a second. There we go. Yeah, I hope everybody can see my screen. Yes. So what is this virtual resource room? Please have a look for yourself and you'll get a better idea about it later.
This is the virtual resource room. First, it uses Zoom. Zoom can provide the audio and the visual, so learners and facilitators can communicate with each other and mime actions like CPR and the all clear. The virtual environment is created by a Google slide. All the learners and the facilitators will simultaneously open up and enter the same Google slide document and make synchronous edits that are viewable pretty much instantaneously by everyone. I want to emphasize this. This is not a screen share. This is a collaborative document. So everyone can be simultaneously making changes like putting on monitors and putting on oxygen and typing in a text box, doing the same actions that you would do in the sim lab. This all makes more sense when you see it in action. Let's check it out. Begin by applying monitors. Learners apply monitors by clicking and dragging the image of the monitor into place over the patient's body. As this happens, you can see the facilitator typing in the vital signs in the text box of the monitor on the right-hand side. Next, get access. Place an IV by clicking and dragging the IV over the patient. Difficult poke, you can show how to do an IO by landmarking and then walking through the steps of the procedure. Assess the ABCs and examine your patient.
If I take a look at his face and airway, what do I see?
If you go to slide 4, you can see a picture of what his face and upper airway looks like. And if you press play, you can hear an audio of his upper airway sounds.
Thank you. So Marley, I see a little boy who is awake and alert. He has some obvious swelling around his mouth and a rash on his cheeks. This is what I hear.
Manage your patient's airway. Click and drag the oxygen into place on the patient's face, then choose your flow rate. To grab extra airway supplies, go to the airway tray on slide 3, copy what you need, and paste in place onto slide 1. Organize at the head of the bed like you would in real life. If the patient's still hypoxic, you might set up high flow or type in the settings you need to start BiPAP. If they need intubation, you can see what your view is on GlideScope. Give medications. Go to slide 2, your medication tray. Copy the med you'd like, then paste it in place on slide 1. Drag it into the medications given box to show it's in the patient. Use machines. You can cardiovert your patient.
So oxygen, I'm going to take it off.
Excellent. So are we all clear? Clear. I'm clear, you're clear, the oxygen is clear.
Point of care ultrasound has been integrated. Look at the image and describe your finding. Do procedures. You can do procedures like this Craig by clicking and dragging pictures of equipment and then using landmarking lines to show where you would make your incisions as you describe your steps. Let's see it in action with the perimortem hysterotomy.
I'm just going to make another vertical incision, just like a nick with my scalpel, and use scissors to open up the uterus.
We're at 2 minutes.
Work as a team, divide into roles, and communicate clearly.
So Sarah, if you don't mind giving 8 puffs of Ventolin to this baby and let me know once that's been done. And if you could auscultate and let me know if his wheeze has improved, that would be great.
And just confirming the Benadryl as well as the ranitidine and methylpred have been given.
Thank you so much for listening to me share the virtual resource room. I also wanted to thank the participants in the demo videos and the many amazing educators I've had the chance to work with over the last year. Now I want to hear from you. I'd love to hear your thoughts, feedback, and suggestions about the VRR so we can work together to keep making the world of online simulation education.
Right. So I'll just stop my sharing for a moment. So the YouTube chat box is live. If you have any questions, please feel free to type. As I was saying, this virtual resource room is a very interesting concept. You saw how easy it is, and it's not like only one student is in control of it because it's a Google slide. Everybody can open that Google slide, and they're all interacting on the same Google slide because they're all present on the same platform. So normally, if you have a software and only one person is running the software, let's say the instructor is running the software, the students have to tell the instructor what to do, and the instructor implements it. But in Google Slides, the advantage is everybody's on board, everybody's collaborating, right? So it's very, very easy, and the platform is completely free. So even though the fidelity might be low to mid fidelity, the learning curve is very simple. There's a very low learning curve for it, and the students take up to it very easily, and you can do a variety of scenarios on it, not just pediatric, even adult, etc. So the virtual resource room is one such concept which is freely available. I highly recommend that you do it, not right now, obviously at the end of the webinar. I promise you that there's a lot more tools that I have to show you, which will be much more interesting. So you can do it at the end of the webinar. So virtual resource room is one. That is one thing you should definitely check out, especially if you're doing, team-based training for your students, undergrads, postgrads, whoever you're talking about. I'll go back to my screen share. Right. So yeah, that is virtual resource. Now, the next one, which is something of a favorite of mine, which comes at a very low cost. It's not free. There are a few cases in it which are free, but the paid model is much more worth it. It's not very expensive. A monthly subscription would cost you around 1,000 rupees. So if you're doing a month-long training to your interns on emergency medicine or critical care, etc., this would be absolutely perfect and must-have for you. This is something called Full Code. Some of you might have used it. Some of you might be using it currently. But I have done all the cases in this app. So let me just briefly show you how the app works. Quickly change my screen sharing to my browser, just a moment. So this Full Code app is available for download on the App Store, on the Android Play Store, and even on the browser. So it can be played even using the browser, which is pretty amazing. Okay, just a second. I'm just sharing my screen. 1 second. Yeah, here we go. Full Code is here. Right. So the moment you open Full Code, you have the option to choose play in browser, right? So you just click on play in browser. You go to Full Code and you have all these amazing cases with you. So we have so many cases, right? You can categorize them according to chest pain or whatever, or cardiovascular system, right? So I've gone to cardiovascular system now, and yeah, you can sort it immediately, right? It'll refresh, and yeah, we can go with this particular case where chest pain patient complaining of chest pain. So it gives you a very quick preview. Case reduction, EMS report, patient is walking in, suprascapular chest pain with feeling faint, alert, no shortness of breath, unstable vitals on arrival, patient is brought to the resuscitation bay. Begin. So before you start the case, you can give a pre-brief. Like any simulation scenario, like anytime you do a simulation scenario, you do something called a pre-brief. I'm sure all of you are familiar with the concept of pre-brief. So pre-brief can take 5 to 10 minutes or maybe longer also. You can emphasize psychological safety. So all my users are one side on the screen. I'm the instructor. And like I mentioned earlier, here, this is not a collaborative platform. Unfortunately, this is not a collaborative platform. Here, the instructor is the one who's controlling the screen. The students are telling the instructor what to do. So there is a one-sided instruction way, but that's kind of the disadvantage of it. But the fidelity is pretty medium to high fidelity, for a virtual platform. So you can go around the room. You can tell the students, okay, students, you can go around the room. This is what you can do, right? You can, you can control the blood controls, all right? You can look at the ventilator settings. You can attach the patient to the ventilator. You can attach the patient to the monitor. You can use the defibrillator for cardioversion, defibrillation, pacing, etc. You can use the ultrasound, right? You can also call a consult, which is pretty interesting, right? You can also call up the consultation and find out what you want. Now, beforehand, what I can do is I can also set up the difficulty. I can make it easy difficulty, medium difficulty, hard. In easy difficulty, if you choose an X-ray, the X-ray will come with a pre-printed diagnosis. In medium difficulty, the X-ray will not have the diagnosis. In hard difficulty, you will have to choose which view, etc. as well. So there's different levels of difficulty, right? So now you can look at the patient. You can have a brief history of the patient, right? You can get what is the complaint, what is the range of pain, and a brief history. You can ask her, right? Ask how her cardiovascular system is. Ask how she feels at the chest level. She's complaining of chest pain, but no shortness of breath. How is she constitutionally, right? Okay, she's complaining of no unexplained weight loss, no night sweats, no fatigue, right? Neurological symptoms, you can ask her. So whichever is relevant to you, right? Whichever is relevant, you can ask her. Examination. Now I can do the entire A, B, C, D, E assessment. I can do an ENT examination. I can do a neck examination. I can do a systemic examination of cardiovascular system, neurological system, abdominal system, respiratory system. Now, I probably want to attach the monitor first. Let me see the vitals, right? And you have a dynamic monitor. The monitor shows you the ECG rhythm, the heart rate, the blood pressure, and the oxygen saturation. This patient is slightly hemodynamically unstable. I'm a little worried about that. So let me establish an IV cannula, right? So the moment I establish an IV cannula, you can see the image changing, right? And IV cannula is established. So do I need oxygen? Not really. Our oxygen saturation is okay. So I don't want to give her oxygen right now. Now, right, chest pain. So my first suspicion would be obviously I want to get an ECG. So I can do imaging. I can do lab work. I can do multiple things, right? I can do X-ray if I want to. I can do bedside tests. I can do ECG. I can go for a finger stick blood glucose. I can perform that. And the investigation result will be right up on my screen. I can click on it. If I want, I can remove the diagnosis or the diagnosis will be showing. So here there is ST elevation in inferior lead. So this is pretty much an inferior wall MI. And the patient is in a preloaded compromised state because she's having inferior wall MI. Now I'll have to worry about that. So this is I have to immediately intervene. Hemodynamically unstable. So I can, if I'm not sure, I'm an intern, I'm not sure, I can communicate cardiology. I can call up cardiology. And here you go. The cardiology says she's concerned about the ECG. She's in the cath lab. She's taking another case in the cath lab. So another 90 minutes, the patient is mine in the ER. So I have to intervene. So I can go for other investigations. I can draw up basic chemistry. I can draw up blood typing and screening because I want to thrombolize this patient, right? I can go for a complete blood picture. I can go for a coagulation panel. And yeah, I can perform those things, right? So you can consider a lag also because you don't want to get the patient to get the student to get the investigations right away, right? So you can click the perform button later. The students will get the investigations later. So it's as simple as that. Here, and the student, the patient will respond accordingly. Now I'm sure your next question is, are these preloaded scenarios? Yeah, I'm sure your next question is, are these preloaded scenarios or can you customize them? With some more investment, yes, you can customize them. That phase of this particular application is in development mode right now. It's in beta mode. So there are some problems with that. It might be ready within a few months, but there is an option to customize your apps as well, customize your scenarios as well. So this covers all the emergencies, all the critical case scenarios, even general examination scenarios. You can teach a seizure case management. You can teach a stroke case management, multiple case managements to your interns, to your PGs. It's very, very interesting. And you can debrief them. At the end of the scenario, this software, it summates what you did, and it gives you an entire summary of how much investigation you did appropriately, how much interventions were appropriate, did you assess the entire system perfectly. Automatically, it gives you the analysis, right? So it has an AI system inside which analyzes everything for you. And at the end of the class, you can use that to debrief the students, a proper structured debrief, plus delta, advocacy inquiry, whatever method you want. And because the students are interacting with you constantly, because the students are telling you what to do, they are working together as a team. So it's very, very interactive, just like virtual research room, but at a much more higher level of fidelity, right? This is Full Code Pro. I definitely recommend that you should check it out, right? So let me stop my sharing and let me go back to the next platform. which I'm sure has been pushed on to you, which has been shown to you by multiple conferences, multiple skill lab marketers, multiple salesmen, which you heard about, which is much more expensive, which is gawkingly expensive, I'd say, is Body Interact, right? Now, Body Interact is similar to Full Code Pro. The only advantage is the mannequin there, the virtual patient is much more, how do I put it, much more dynamic, right? He interacts with you more realistically compared to Full Code Pro, right? Now, and you have a lot of general medicine cases, general pulmonology cases, not emergency appropriate as such. So you have a bigger library of cases in Full Code Pro. Let me share my screen and show you Full Code Pro for a moment, if you haven't seen it already. So some of you might be familiar with Full Code Pro, but sorry, with Body Interact. But Body Interact is also a very interesting tool, and yeah, it has a lot of user interfaces and a lot of fans abroad. Many people use it abroad. Yes, Body Interact. So again, no conflict of interest here. I'm not in cahoots with anybody, but yeah, you get the idea that these are very, very interesting tools. Body Interact has a trial version online available for their COVID-19 scenarios, which you can try out and you can completely understand it. They charge a significant premium for Body Interact though, so they should keep that in mind. But yeah, the level of fidelity is higher fidelity when you talk about distance simulation at least, right? So we have virtual research room, which is completely free. We have Full Code Pro, which comes at somewhat of a smaller premium, and we have Body Interact, which is a very high premium. Okay, so yeah, we'll come back to my slideshow where we'll talk about other tools. Right. So there is one more tool called Simple Patient Simulator Monitor app. I'm sure most of you heard about it or even have it on your phone right now. SIMPL, right? SIMPL. What it does is basically it uses your phone. It uses your phone and a virtual screen. The only disadvantage is you can't use it on a computer screen unless you have the knack of computers and you can replicate the screen, or you can stream the screen onto the computer. So what it does is it basically has a simple interface where you have the app, right? You switch on the app and it gives you two options: start simulation and join simulation. So you use another device and you connect your simple screen here to that simple screen app there. Only thing is you have to buy the license on both the devices, right? And whatever vitals you change here on this screen on your mobile device will reflect on the monitor screen. And the monitor screen also has a defibrillator panel where you can, charge, defibrillate, cardiovert, and even pace. So simple app is something I highly recommend. The lifetime license is not very expensive. I think it costs somewhere between 500 to 1,000 rupees. You can check it out. If you're doing a lot of patient simulations, if you're doing in situ simulation, right? You are doing simulation at the patient bedside in the hospital. This is an excellent app. You can just carry your iPad with you or your screen with you, and you can put this as a virtual screen, and you can play with the vitals as much as you want. And all the vitals are interlinked. You give hypotension, you can expect a tachycardia automatically, right? There's a physiological component to it as well. So it knows how to respond to that. So that is also possible, right? Now coming to specific scenarios. So when you come to specific scenarios, I talk about broad spectrum, broad usage of simulations. But yeah, when you come to specific scenarios, when you come to specific scenarios, you have for CPR training something called Anywhere. Some of you might have checked it. Some of you must have heard about it. How many of you heard about Anywhere? Please type in the comments if you used it. So Anywhere is an excellent tool developed by Ladle. Ladle's team has developed it because of the pandemic. And I'd say it's one of the simplest usage of CPR practice. All the student needs is, a mobile phone with a front-facing camera, right? And I'm sharing my screen again, just a moment. Right. So here we are, anywhere. So what you can do is, it'll give you a code, right? It will give you a particular code, classroom code. You can type this code onto your mobile device, 922629. Okay, 9267. Okay, I'm just typing it. Right, I'm typing it. I'm entering my name. Right, there I am, Raj. Okay, I don't have a mannequin with me, so I'm just clicking on press here. Right, so the device, the mobile device, it switches on my webcam. Yeah, and I have to make sure that the only thing I have to make sure is that my face is visible on the screen. And yet, as I do the CPR, you can see on the screen what happens, right? Okay, I'll just use my mannequin here because I have a mannequin right now. At home, if you're teaching your students CPR, you can use a pillow, right? You can use a folded pillow or 2 folded pillows, right? And you can ask them to do CPR. And the camera will, because of the movement that you're doing, the camera will analyze your metrics and will tell you what rate and depth you're doing CPR, right? So it is, yeah, I know this is not high quality CPR. I know my elbows are not straight because the table is a high table, but I know I'm not counting, but you get the idea, right? So the camera on the mobile phone will connect to the software and it will tell me what rate and what depth I'm doing CPR. You can teach CPR virtually through this. This is incredible technology, right? This is the most innovative use of your mobile phone as you can see fit. So yeah, and at the end of it, it also gives you a feedback. It tells me, how many students have participated. Only one person is joined right now. And it'll tell me how much I left the class. So it'll tell me how much feedback was done, what is the rate of CPR I did, and things like that. So here you go. So compressions, class duration, how much I did, and what is the rate done. It'll give me a comprehensive overview of how many students joined. And the software is freely available, by the way. It's not even expensive. It's freely available. So you can join multiple students in, and it's pretty great use of technology. Now this is for CPR practice, anywhere from Ladal, right? I recommend that you try it out. This could be a great tool for teaching lay rescuers CPR, right? They could just simply get a pillow, use this app, log in, and you can see on the screen how good they're doing, how poor they're doing, right? And it's pretty damn brilliant, right? So that is about laterals anywhere. The next specific tool, which I found very useful, especially in this scenario, is something called Airway X, Airway EX, right? I'll share my screen again, my PowerPoint. So Airway X is this brilliant tool developed by a company called Level X, right? This has a game-based module inside of it. This Airway X application, which you can see on my screen right now, it has a game-based module where it will give you a patient scenario, and you have to decide what you're going to do with the patient. Are you going to intubate him? Are you going to pre-oxygenate him? Are you going to go for direct laryngoscopy? Are you going to go for video laryngoscopy? Are you going to go for fiber optic? So it has different case-based modules, and the software responds intuitively. So let me quickly show you a video where we tried out using Airway X, and I think you'll get a better idea of how it works. And again, it's freely available, by the way, which makes it even more amazing, which is what we want. One moment. I'm sharing my screen. I hope all of you can see it. Just a second. Yep, we're ready. Yeah, here we go. So this is Airway X. So it has different levels of intubation where you can learn laryngoscopy as well. But this is about diagnosis, clinical decision making, right? So that's COVID modules. The first scenario is what you see here. It's a very intuitive platform as well. So here's the patient, right? So it's telling me details about the patient as well, right? 55-year-old man presents for ORF for broken femur with a confirmed negative coordinate status. It's telling me a proper anesthesia classification. There's a short neck, there's a thick beard, and there's a Mallampati of 3, right? So I need to be a little wary. Saturation around right now on room air is 95%. So let's go ahead and start the scenario. Let's see what happens. Once you click on start, it'll show you all these options, right? It'll show you if you want to pre-oxygenate, if you want to attempt awake intubation, if you want to induce the patient, if you want to go for rapid sequence intubation, if you want to limit the staff in the room, if you want to don N95 mask and PPE, right? And every time you do an appropriate steps, it gives you points. Right now, you're at 50 hero points. because it gives you baseline points because you could do wrong step and it will fail you. It will give you negative marking as well. So it's positive marking and negative marking. So and a baseline point. So if I do a neutral step, it won't give me any points. If I do a good step, it will give me positive. If I do a wrong step, it will give me negative. So just watch. So what I did was because I'm not sure, it says COVID negative, but I want to be safe. So I wanted to don N95 mask and PPE. And it immediately says you don the N95 mask and PPE, but right now you wasted one N95 mask and PPE set, so somebody else might use it. Right, you continue, you go to the next scenario. Now obviously 95% saturation. I probably want to bring it to 100%. So I go for pre-oxidation. It'll ask me which device I wanted for pre-oxidation. So I used high flow nasal cannula and I went for pre-oxidation. Saturation 100%. Now I want to attempt intubating the patient. So I went for RSI, rapid sequence intubation. Despite knowing malaparity and short neck and beard, I attempted direct laryngoscopy. Let's see what happens. It failed. So it gives me -3 hero points, right? So because of the patient factors, it clearly mentions the reason also. Patient factors, short neck, beard, malaparity, direct laryngoscopy was probably not the best idea here. And mind you, the patient is sedated and paralyzed, so saturations are going to drop soon. So what do I want to do? Right. So I went for video laryngoscopy and that was successful, right? So you can use different methods. It's a game-based software. And what I can also do is I can review this patient. I can review my steps. I can teach the student. So you went for first was don N95 mask, which was unnecessary, so 0 points. You went for pre-oxidation with non-rebreathing mask, so +1. You sedated and paralyzed the patient. You went for direct laryngoscopy, which is not ideal here, and you went for video laryngoscopy, which helped you, which worked, right? So another patient example here, which I can show you. So it has multiple patients like this. It goes step by step, each one with a different level of difficulty. And you see the software is very pleasant. It's very, very intuitive. So COVID negative status, okay, good posture status likely. Let me just read the scenario again for you in case you're wondering. Right, okay. Woman, 45-year-old woman, COVID positive, respiratory distress, requires intubation, negative pressure room unavailable. So obviously we'll don N95 mask and PPE. So I got 2 points for that. I could have probably limited staff in the room, but I forgot about it. 83% saturation, I'm not happy about that. I really wanted to pre-oxidate this patient. Right? So non-rebreathe the mask used, pre-oxidated. And airway secured with video laryngoscopy. Yes, that is the standard of care for intubating a patient with COVID positive status, despite your PPEs, right? So you can do all these things with airway X. So there's multiple softwares like this that are available, for your usage. Now I think I'm still sharing my screen. I'll show something called a ventilator software, which is also available for not that much of a price. Let me just share the ventilator software. We spoke about airway, we spoke about compressions. Now the biggest one of it all, which is going to be ventilator management. Now there is a particular software which I'm sure some of you heard about called XLung, right? So XLung is developed by this South American company, right? And they have this demo available online. So once I switch on the simulator, right, I can show everything possible with the ventilator, right? Now this is a normal patient without any abnormal respiratory effort, and I can see the graphics which are seen as normal. This is very, very rare to find because most of the intubated patients in our hospital are ventilated because of abnormal, right? Unless they're in the operation theater because of elective surgery. Yeah. You can see what it looks like in a normal patient. You can see the tidal volume, you can control the flow volume, you can see the mechanics, everything. Now I can immediately change it to an abnormal patient. I can make a diarrhea severe. I can confirm it, and I can see how the dynamics change. I can see that the patient's saturation is dropping drastically. Now I can make changes, right? I can check the patient's ABG. I can do all those things. So we are running out of time, so I'll just cut short this particular demo here. But you understand this XLung software is available as well. It's not for free. The demo is for free, but it comes at a very baseline price. It's not very expensive as well. Similar to XLung, there's another software called TrueVent, which comes at a more higher premium. It has its own pluses and minuses, but I'd recommend that you try these both out, XLung and TrueVent. These are the leading ventilator simulation softwares available online. It saves your time, it saves your money when you're training students, especially at the time of COVID, where you're training your undergrads, you're training your interns, you're training your PGs to go to the website and teach ventilators, troubleshoot the alarms. This is perfect for it. Yeah. Now, we're coming to the end of our topic almost. Have I missed anything? Any other simulators? I don't think so. Yeah, we've spoken about everything else. Now let's come to assessment. Now we spoke about the tools for teaching. Now assessment is absolutely essential. Now some of us who are into teaching and who understand pedagogy know that there are three types of assessments: diagnostic assessment, formative assessment, summative assessment. Diagnostic and summative assessment are pretty straightforward in the online learning space, right? When it comes to diagnostic assessment, you do a pre-test, you can send a Google form, you can send a Kahoot beforehand, you can take a survey, and you can get an idea of what the students require. You can do a needs assessment of sorts. But formative assessment is absolutely essential during teaching an online class because you want your students to remain engaged. You want your students to keep their webcams on. You want your students to keep their microphones on. So how do you go about using formative assessments? Now, there are several tools which can be used for formative assessment. The most common tool which I've seen people use is Kahoot. If you haven't heard of Kahoot, please try it out. Kahoot. Kahoot is a brilliant tool for making sure that you have the students engaged in your classroom and you are understanding what they're understanding. So Kahoot, basically, you can create quizzes, you can create online quizzes, and the student will see the screen on the laptop while he's studying the class, and he can answer the questions on the phone, right? Ideally, you'd want 2 devices for Kahoot. That is a little bit of a luxury for some students when they're especially logging in from their mobile phones for the class. In that case, they can see the question on the video platform which we're using. They can minimize the app. They can open Kahoot and answer the question. It doesn't matter. It makes it less competitive, but they can still answer the question, right? That can be done for Kahoot. Now, there are other apps which are better than Kahoot, right? Although Kahoot is the most widely available and user-friendly, there are other apps available for using for teaching, for using as well as for formative assessment, right? This is one.
When a presentation lacks energy.
The advantage of WooClap is that, it has even image-based questions.
Keen to captivate your audience? Rather than compete with smartphones, WooClap turns them into an exceptional learning tool. Participation has never been this quick and easy. Your audience can answer by text message or via internet on any connected device. WooClap offers a wide range of features that make participation easy and bring your content to life. View, interpret, and comment on the results in real time. You can create find-on-image questions, multiple choice questions, word cloud, and many others. WooClap is also an interactive platform that establishes a real dialogue with your participants. And all this happens in real time. If you want to make your presentations fun and effective, then sign up to wooclap.com free of charge today.
Right, so that is about WooClap. So there is Kahoot, there is WooClap, there is, so the thing about Kahoot and WooClap is they really help in formative assessment and they give you an evaluation of what the students are doing as well. Now, beyond this WooClap and Kahoot, you can also use something called Google Jamboard, which I'm sure some of you have used it. Google Jamboard helps you collaborate with students. Rather than assessing individual students, you're getting them to collaborate as a group together. So what you can do is you can, as you're teaching a topic, you can create a breakout room. You can create multiple breakout rooms, divide the students into breakout rooms, and ask them to come up with ideas and thoughts on a particular topic using Google Jamboard. So they have to interact with each other. They type on this Jamboard, and you are evaluating all these slides, right? You can assign each student one board, right? So this is a Jamboard I'm sharing from one of the classes I attended recently. I'm not sharing the content obviously because it's confidential, but I'm just giving an understanding of how each team can come up with a Jamboard, and they can share their thoughts of what they thought, and they can attach stick-ons, they can create graphs, they can create tables, things like that. So it's pretty intuitive. Yeah, that's about Google Jamboards. Now, Jamboard helps you assess students on a much higher level because you are helping them interact with each other, right? Now, let me come back to my slide share for a moment.
Raj, as you're sharing screen, there is a question on the chat by one Dr. Bandari. Are there chances that a person skilled in performing interventions on a live patient may find it difficult to perform virtually?
Yes. So it works both ways. A person who's doing virtually may not be able to do it live, and a person who's doing live might not be able to do virtually because it all comes to your sense of intuitive. So I'm someone who's grown up playing video games, right? So my dexterity with my fingers are much more easy on the video game than with the patient. It might be the opposite for a surgeon who's experienced on the patient than with the virtual game. So they're not correlated at all. They're not relatable also. You can't extrapolate the data you get from a virtual game to a patient side. I don't think that's fair or that's even possible. It will only add on as an adjunct. It will only help you learn better. That's all. It's not correlatable. It's not extrapolatable.
Thank you, Raj. Thank you.
There is a lot of research being done in that platform. I can assure you that, because a lot of the current generation virtual reality simulators are game-based modules. You have these lab mentors, robotic surgery simulator mentors from Symbionics, from 3D Systems. All these mentors are game-based modules, and there is research on construct validity, on content validity, etc., going on right now. So some of these devices are so good that when a student does a procedure on this particular game-based module, the device will be able to predict whether the student is a novice or an intermediate level practitioner or an expert level practitioner. So there is some amount of data on it. I'll be glad to share it with you, Dr. Bandari. Please share your email ID in the chat box. I can send you the studies which are there on the validity of such tools. Right, I'm coming back to my screen sharing again if there are no other questions. Right, so yeah, coming to assessment, there is something called a think, pair, share model, right? So this is absolutely essential when you're talking about formative assessment and formative learning, right? So this model is important. You should know what this think, pair, share is. So think is where the students think about the problem. Pair is when you pair them up into groups, and share is they come back to the main group and they talk about what their experiences are, right? This could be a brilliant way of getting the students more engaged. You know that they have to do this. This is an assignment of sort for them. So you teach a class, you let them think about it. You pick them into breakout rooms, right? Divide them into breakout rooms. Let them discuss in groups. Let them come up with different ideas. Let them make a presentation out of it as well. See how the presentation skills are. You can test them on that level as well. And let them come back to the main group. Assign each group some amount of time and let them talk about their particular experiences, right? So this think, pair, share model has multiple connotations, has multiple different variations. There is think, pair, share traditional. There is think, write, pair, share, where they can write and discuss about it. And yeah, there is also think, pair, square, share. They snowball into other groups. They go to other groups and talk about what they discuss in the other group. So that can add multiple levels of thought process to the main group. And yeah, there's 7 levels of doing this. Think, pair, share. Think, write, pair, share. Think, pair, square, share. Think, broadcast and share. Think, broadcast, vote, share. I recommend that you read about this. I can share the link in the group. I'll also see if I can share this presentation with you all through your email ID, so you can go ahead and discuss all these things about. This video will be constantly available on the YouTube platform. We'll publish it, so you can come back and check later as well. And ma'am, that pretty much concludes my talk today. We spoke about different tools. We spoke about the different assessment methodologies and how you can formatively engage the class. We can take questions now, I think, ma'am.
Yes, thank you so much, Raj, for that session. If there are any queries, please do let us know on the chat box. As of now, I can't see any queries on the chat box, Raj.
I think, yeah, please put your queries. Now, what I'll do is I will share the feedback form. And if you submit your feedback, you'll also be emailed a certificate for attending this webinar. Thank you so much. The feedback form will be submitted in the chat box, so you can click on it and share your feedback.
Thank you,
if there
Raj.
are other questions, we can end the stream and I can publish the video so that people can come back and see it.
Yes, there are no more questions, Raj. I don't think. Okay, there is a question. Could you suggest apps for surgical simulation from Dr. Karen?
So, yes, ma'am. Dr. Karen, I believe there's a surgical simulation app. I'm not, the name is not striking me right now. Ma'am, are you aware there's an app from the UK? The problem with surgical simulation is step-by-step learning. It's not like where you can do the surgery and see as such. You just have to go like an OSCE checklist where you prepare check by check and checklist by checklist and yeah, touch surgery. I'm sorry, yeah. The app name is Touch Surgery. I just recollected. So Touch Surgery is developed by Medtronic, which is a very reputable surgical company. Now, there are multiple simulation scenarios in that particular app, but it's not where you can use the surgery, use your devices and all that. You can just go step by step like how we did in virtual research room. So Touch Surgery is an excellent surgical simulation app. They're coming up with an augmented simulation software as well. Eventually, it will be there in the market, but that does help you with mobile-based simulation learning for surgery.
Thank you, Raj. There's
Yes.
one more question from Dr. Manoj. Can simulation replace skill lab?
Lulu ma'am, do you want to take that question? I think you're more experienced to take that question than me.
So we do simulation in the skill lab. We do simulation inside too in the workplace, something called bile simulation. So if your physical structure, so you don't require a skill lab to do simulation is my answer for that. If Raj, you want to add anything? Yes,
Yeah,
and we
yeah.
based on experience, nowadays especially, we prefer taking the simulation outside the skill lab into the real-time environment for better learning. And it's more of the technique in your instructional design rather than the technology. So that's what I want to say in this.
Yeah.
Anything to add, Raj?
Yes, ma'am. There is something called the Yokes-Dodson curve, right? There's a study called the Yokes-Dodson curve, which shows that peak performance comes only with certain levels of stress. You can't keep the environment too controlled, and you can't keep the environment too chaotic and too stressed out. It has to be a certain level of the right balance so that the student's performance also peaks, and that's where you have to target your simulation. And I think in situ simulation, where you can take it to the patient side, to the bedside in their real environment, that adds that amount of stress so students can perform at peak.
Yes, there's one more question from Dr. Yuvraj. Are there any specific simulation website for training dental?
There are simulation tools available for training dentists. There's a software called VertEasy. I'm just typing it here, VertEasy, right? The problem with VertEasy, though, it's a device-based software where you have to have a VR device, and you can do a lot of simulation through that, but it's not available on the mobile device. It requires investment. You have to buy the equipment. It requires a personal computer. It requires a virtual reality device. It's expensive. It's not cost-effective at all. But dental simulation is the future. We have to really think about how simulators can, use technology at a low level, at lower cost to teach dental students as well.
And just to add on, there are a lot of phantom heads and task trainers available for the dental, including the whole dental chair itself. So there's a whole scenario you can create, and it is available. If you can share your email, we can give you links for that. And Dr. Karen, there's one more app. It's an Indian app for short cases in surgery. It wasn't coming, so I had to browse that because I forgot about it. OSCE for medical doctors for short cases in surgery. Beautiful pictures, actually, and they can do it on their own, for self-directed learning. So you can just go through that app. It's short cases in surgery, available on both Android and iOS. OSCE for medical doctors. You can try that out. So I cannot see any more queries. There are requests for, can you please share the presentation, Anuja, Archana? Yes, we will be sharing the slides and it will be available on YouTube. Clinical vignettes versus, there's one more query. Clinical vignettes versus simulation. Okay. So if, Raj, do you want to take it up? I think
by clinical vignettes, they want to talk about specific learning methodologies from the clinical side. That's what they're talking about, I think. Lulu ma'am? Yeah. So
I think what Dr. Manoj meant was, yes, exactly. That's what he meant.
Sir, what we talk about simulation is always this. It's never a replacement. So in our generation, we all we had was clinical vignettes, right? When we learned medicine, there's no simulation as such. So I think this question is better placed to a student than us. We might think simulation is much better because we're doing simulation, but the student might have a completely different perspective. But in my experience, at least, I find the student much more happy in the simulation lab than at the bedside, than at the patient side, especially when you're doing cadaveric dissection and cadaveric anatomy tools and things like that. Because this is technology. This is like a video game for him. He's having fun here. So maybe you have to put the fun back in clinical case taking.
And just to add on, when we say clinical vignettes, we're giving them a problem. So we are testing their clinical reasoning and decision-making skills, but it's more of a problem-based learning. And when we say simulation, we are actually immersing them in a real-time environment. So there is an experiential method of teaching there. And then they reflect on the actions they have done, where we can actually, cover their cognitive, procedural, as well as the affective domain. So it's kind of wholesome, but like Raj mentioned, based on the feedback of the students, yes, they do like participating in simulation, provided your instructional design is good and you are able to achieve your objectives during the debrief. There's one more query. Can you please tell about yourself a little? Raj has already placed his email. I think Dr. Goyal has joined a bit late. Yes, I will introduce Raj again. So Raj is presently heading the GSL skill lab in Rajamundry. He's an emergency physician, and he is one of the key dynamic members of the society, which is SHS. I hope I answered your question, Dr. Goyal. So the institute he's working in is GSL. Yes, GSL Rajamundry. Yeah.
Yes, ma'am. So I've shared the feedback from everybody. I hope you found it. I'm resharing it just in case. So you can please submit the feedback and you'll get your certificate for the attending the workshop for the webinar. I really hope we met the objectives of the webinar, and thank you, Lulu ma'am, for moderating the session.
Yes, and before we wind up, Raj, before we wind up, I think we can announce our upcoming SimulCon.
Yes, ma'am. Yes. So before we wind up, we have big news to share, which is very important for us, and we've been working towards this since a long time. So I'm just sharing my screen a little bit. So basically we are ready with our next event, which is SimulCon 2021, our third national annual conference. We've been working on this since the past 6 months, I think. And this is a marquee event for SHS Society. And just a second, I'm sharing the wrong page. So the Society for Healthcare Simulation has put all of its efforts into this, making this event a reality. And the SimulCon 2021 is going to be a 3-day completely virtual conference on popular demand, and considering how much feedback we got on the virtual nature of the conference last year. So I hope all of us can get together on that platform. And SimulCon is a great event. We have international collaborators. We are tied up with ASPE. We're tied up with SSIH USA. So there's a lot of I hope everybody can see my screen. Yeah, there's a lot of expertise coming into this particular event, right? And the main theme of this year's particular event is driving collaborative practice through simulation. This year, more than ever, we realized how we have to work together as different professions, right? Irrespective of where you were working last year, you all had COVID duties. You all worked in the COVID wards, whether you're preclinical, paraclinical, or clinical. So understanding that healthcare is a multidisciplinary interprofessional system, it requires that you work together as a team. It requires that you understand your space and your roles clearly. That's what the theme of this year's conference is. So we are starting registration soon. We'll be announcing our website shortly. We'll be sharing all those links with your email IDs. Please follow the simulconindia.com website. I'll be sharing the website in the chat box as well. So please come to the conference. Right? We don't charge much. It's very, very nominal for a virtual event. There are going to be pre-conference workshops. There's going to be a 2-day conference. There's going to be panel discussions, debates, a poster presentation competition with amazing prizes. Right? So please come and join. Lulu ma'am, do you want to add anything?
They wanted to see the brochure. Your screen is not visible.
Just a second, I'm sharing the screen. Yep. So yes, SimulCon 2021, driving collaborative practice through simulation. Registration commencing soon. So it's going to be the virtual simulation event of the year. It comes on a very intuitive virtual conference platform. All of you will be able to log in, walk through the different lobbies, go to different halls, go to the poster presentation area, go to the exhibit area. It's going to be very, very interactive and very, very interesting. My contact number is there as well. So people who are interested can ping me on WhatsApp. We'll show you more details. The website is simulconindia.com. It will be live soon, hopefully, and we will share you the website through your email IDs, which you registered for. Lulu ma'am?
Yes. Yes, thank you. Thank you so much, Raj. So I think we can wind up. Raj, you have Instagram requests by the participants, so you can go back and check your Instagram.
Okay.
So thank you so much. Thank you everyone for joining. Please do fill in your feedback and you will receive your participation certificate. Thank you so much, Raj.
Thank you, ma'am. Thank
Good
you.
night.
Thank you, everyone.
Yeah.